Oxybutynin chloride is a medication used to treat bladder and urinary conditions, such as overactive bladder. It works by relaxing the muscles in the bladder, which helps to reduce problems like urgency and frequent urination. Oxybutynin chloride is classified as an antispasmodic drug. The typical daily dosage is determined by a healthcare professional, and it is important to take it at the same time each day for the best results. It is advisable to take oxybutynin chloride with a glass of water, and it can be taken with or without food. Always follow the directions provided by your healthcare provider for the best possible outcome. When taking oxybutynin chloride, it's important to follow your doctor's instructions. You may take it with or without food, usually 2 to 3 times a day. The dosage and duration of treatment will depend on your medical condition and how well you respond to the medication. If you are using the liquid form, make sure to measure the dose carefully with a special measuring device or spoon. It's important not to use a regular household spoon, as it may not give you the correct dose. To get the most benefit from oxybutynin chloride, it's important to take it regularly at the same times each day. If your condition doesn't improve or gets worse, be sure to inform your doctor. Some common side effects of oxybutynin chloride may include dry mouth, dizziness, drowsiness, blurred vision, nausea, vomiting, and constipation. To relieve dry mouth, you can suck on sugarless hard candy or ice chips, chew sugarless gum, drink water, or use a saliva substitute. To relieve dry eyes, you can use artificial tears or other eye lubricants. To prevent constipation, it's important to eat dietary fiber, drink enough water, and exercise, and you may also need to take a laxative. It's important to remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. However, you should tell your doctor right away if you experience any serious side effects, such as decreased sexual activity, difficulty urinating, fast or pounding heartbeat, mental or mood changes, swelling of the arms, legs, ankles, or feet, vision problems, seizures, or stomach or intestinal blockage. A very serious allergic reaction to this drug is rare, but you should seek medical help right away if you notice any symptoms of a serious allergic reaction, such as rash, itching or swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects, you should contact your doctor or pharmacist for further advice. Before taking oxybutynin, it's important to let your doctor know if you are allergic to it or have any other allergies. This medication may also contain inactive ingredients that can cause allergic reactions or other issues, so be sure to discuss this with your pharmacist. Before using oxybutynin, be sure to tell your doctor about your medical history, especially if you have conditions such as glaucoma, bladder disease, certain muscle diseases, heart disease, high blood pressure, liver or kidney disease, dementia, nervous system disorders, enlarged prostate gland, stomach or intestinal diseases, overactive thyroid, or Parkinson's disease. Oxybutynin may cause dizziness, drowsiness, or blurred vision. Avoid alcohol or marijuana, as they can increase these effects. It's important not to drive, operate machinery, or do anything that requires alertness or clear vision until you can do so safely. Limit alcoholic beverages and talk to your doctor if you are using marijuana. If you are planning to have surgery, be sure to inform your doctor or dentist about all the medications and products you are using, including prescription drugs, non-prescription drugs, and herbal products. This medication may increase the risk of heatstroke due to decreased sweating, so it's important to avoid becoming overheated in hot weather, saunas, or during exercise or strenuous activity. Older adults may be more sensitive to the side effects of oxybutynin, especially drowsiness, confusion, constipation, and trouble urinating, which can increase the risk of falling. If you are pregnant, this medication should be used only when clearly needed. Talk to your doctor about the risks and benefits. It is not known if oxybutynin passes into breast milk, so consult your doctor before breastfeeding. When taking oxybutynin chloride, it's important to be aware of potential drug interactions. Certain medications and products can affect how oxybutynin chloride works, or increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with oxybutynin chloride include pramlintide, drugs that can irritate the esophagus or stomach, such as potassium tablets/capsules, and oral bisphosphonates including alendronate and etidronate. It's important to inform your doctor or pharmacist if you are taking other products that can cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or antihistamines. Additionally, check the labels on all your medicines, including allergy or cough and cold products, as they may contain ingredients that can cause drowsiness, constipation, or blurred vision. Make sure to ask your pharmacist about using those products safely. If someone has taken too much oxybutynin chloride and is experiencing severe symptoms like passing out or difficulty breathing, it's important to call for emergency help right away. U.S. residents can contact their local poison control center at 1-800-222-1222, while Canada residents can reach out to a provincial poison control center. Symptoms of overdose may include delirium and paralysis. This medication is used to treat certain bladder and urinary conditions. It helps to reduce the muscle spasms of the bladder and the urge to urinate frequently. Oxybutynin belongs to a class of drugs known as antispasmodics. It helps to decrease the symptoms of overactive bladder, such as frequent urination, urgency, and incontinence. This medication works by relaxing the muscles of the bladder. Oxybutynin is usually taken by mouth 2 to 3 times a day with or without food, or as directed by your doctor. The dosage is based on your medical condition and response to therapy. Swallow this medication with a full glass of water. Do not crush, chew, or break the tablets. Taking this medication at the same time each day will help you to remember. If you happen to forget a dose, take it as soon as you can. But if it's almost time for your next dose, just skip the missed one and take your next dose at the usual time. Don't take double the dose to make up for the missed one. When it comes to storing oxybutynin chloride, it's best to keep it at room temperature, away from light and moisture. Be sure to store it in a safe place away from children and pets, and definitely not in the bathroom. When it comes to getting rid of any unused oxybutynin chloride, don't flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, make sure to properly discard the product when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.